We have an outstanding new generation of healthcare leaders who understand that their corporations will only be accepted in the world if they demonstrate the relevance of their skills to the global citizen. No longer just the wealthy, no longer just the West, but they truly have to demonstrate how they will make their skills and technology relevant to everyone in the world. And this is extraordinarily helped by the measurement of their achievement. And the innovation we heard about of the healthcare indexing is an extraordinary mechanism to continue to encourage our healthcare leaders to demonstrate that it is wise for them not only to penetrate the developing markets, but always to drive their technology at the hardest sector, very often in the rural communities in the poorest nations.
And as we innovate and create new solutions, we have to think not just about new tools for prevention, diagnosis, treatment, but for new tools for reducing distance, whether that is the distance, physical distance from a health facility and a trained health worker, or whether it's the social distance. And some of the new potential tools and information and communications technology we'll hear about this morning, I think, are good examples that we need not just new tools, but technologies, but new ways to reduce distances and new ways to create better informed individuals, families, and communities. And the third thing I took away, mostly from our discussions yesterday, where we had very active participation, as we will again this morning, from our industry colleagues, was the importance of public and private partnership to create a solution set and deliver it. We heard yesterday several very eloquent and passionate examples from our industry colleagues about their devotion to a global business model to bring the fruits of science and technology to everyone, not just the top, most well-off 1 billion people on the planet. But if we're going to actually create that innovation, the benefits of that innovation for everyone, it has to reach everyone, and it has to be delivered to everyone. And there's not much that the industry can do on its own about delivery. The industry could theoretically sit in an R&D facility and come up with a very new even an inexpensive gizmo that could have some benefit for maternal and newborn health. But it's really going to require partnership with governments, with local communities, with nonprofit organizations to make sure that those innovations reach the people who need them the most. So, in fact, I think we have a bit of a danger at this conference that if we generate this much enthusiasm among the private sector industry to help us solve these problems, and we in the public sector don't follow through with the delivery, we're going to lose our credibility in terms of our ability to partner for success. And that will ultimately result in a waning of this new and energetic interest we've seen from industries.
What if we were to radically modify those interventions, radically modify the equipment, and ask the question, could we pull this down and make it more available peripherally? Could we put it in the hands of physicians in a first-line clinic, put it in the hands of a community health center, for example? And there are a number of interventions that could come to play here. One would be the surfactant that these newborns get. Currently, it's endotracheal administered. Could we administer it into the oropharynx and have it inhaled in the process of ventilating a baby? We need new ventilation equipment. Could we make it much more simple? We need to warm that baby. Could we provide a simple type of incubator to help support that baby? Simple suction device, IV fluid drivers that are more simple and more reliable. A whole variety of things would come into play. So these are some of the ways that we're thinking about technology. Again, some of them very simple, some of them currently very highly technical, but we believe could really play a role peripherally in the system. So in terms of technology, we need ideas. We need to prove the concept of those ideas. We then need to translate those ideas into products, get them in the market, and then deliver them at scale.
The first philosophy, and perhaps the most important one, which relates directly to your question, is that it's our belief that the invention and propagation of disruptive technology is central to our collective ability to succeed in providing solutions to the underserved. And by disruptive technology, I truly mean taking our technology knowledge, which we have at the high end of medical care, and taking portions of that and applying it to specific problems for the underserved. We've talked a lot about a variety of things, but in the area of telecommunications, the cell phone is perhaps the most prominent example of disruptive technology being used to completely change the way in which people communicate in the world. We want to do the same thing in healthcare across a variety of areas, and I think the opportunity in healthcare is much richer and much broader, and virtually every segment of healthcare offers that opportunity. Finally, the only other comment I'd like to make is that I know people are worried about cost. Cost is obviously an issue. But our philosophy there is, look, get this in the ballpark. Get this so that we're close, and then we'll work the cost. Because cost is a function of your economic model. It's a function of the volume that we put out there. And if you get too hung up about that to start with, we won't get anywhere. So I'm confident that we have the ability, the technology, and our business capability in terms of how we tier these products and how we approach the market with them economically, that we can get the cost down to where it has to be.
Health literacy really starts with one word, and that's empowerment. Empowerment of the individual consumer to take hold of their bodies and their engagement in their own health care. But in order to do that, you have to make a connection to her as a consumer. That's what we do at Baby Center every day. We don't work with industry. We don't work in the professional environments. We work directly with mom. And we know how to talk to her. And we know how to support her. And we know how to put our arms around her and teach her in small, bite-sized chunks.
So I'm really glad you brought up mothers and parents and households, because it's really about how do we empower them and how do we move from a sick child or a sick care mindset to a mindset around health. So we need to make sure that we're creating technologies that really make the most sense for those households and parents. They are spending money on health. They're spending money on traditional birth attendants. They're spending money on traditional healers. They're going to pharmacies where they get inappropriate drugs or fake drugs. And so that very limited resources that they have, we need to make sure that they're spending their money wisely. So we want to make sure that those technologies are appropriate, that they're addressing the key forms of child mortality and maternal mortality, and that they're durable, that they can exist in those very difficult, hot, dusty, remote environments.
Wireless connectivity reaches 6 billion people. It's more available than water or electricity. It's really profound. 4.5 billion people on this planet use a mobile phone. That's a very sophisticated piece of computing technology. Vastly more computing today is owned by individuals than by corporations or governments. That is astonishing. Most of the people who own one of these devices make less than $10 a day, and most of them have never seen a doctor, nor will they in their lives. It's a profound shift. Now, it's important when you make these observations not only to say, gosh, isn't that interesting, but how did that happen? It's not an accident. It's a conscious strategy by an industry. If you look up the meaning of the word consumerization, it is defined as a strategy adopted by the technology industry to sell its products to consumers, not professionals or corporations, to increase the rate of innovation, improve reliability, and expand their global reach. It's a business strategy, and it's one that we should adopt, consumerization. And for us, what that means is the mother, not the government, and not the doctor, is the customer. That's a pretty profound shift.
Are these liberating technologies, or are these dependence-producing technology? We know science and technology shapes our lives, but technology has got one intended effect. In this case, intended effect is improving health, removing disease. But technologies can also produce disempowerment, they can produce dependence, and in that sense, they can produce a political disease. So we need really technologies which will make individuals, families, women, communities empowered for either self-care, self-diagnosis, home management, community-based management, so that technologies, apart from their intended health effect, also are politically liberating.
I've been listening quietly for days and gathering so much information and overwhelmed with the opportunity that is in this room. That industry and the health sector have come together in one place, which is not a commonplace thing. And I would like to urge those who have offices, for example, in countries like Africa, to extend their hand out to industry and partner with them more, because we have learned in this room how it is done, how we can partner, how we can work together.
We need to join the rest of the world and adopt modern information technologies underlying all of the things that we're doing. Whatever intervention you're doing, you need to keep track of it. Whatever intervention you're doing, you need to give people information about how to do it. And the modern way to do that is to use the device that everybody has already adopted. The technology is already out there. There are almost 5 billion of them. So let's just get with what the public has already said that they want and already knows how to use, and use that system to enable everything else we're doing.
There is a huge opportunity of developing some of these lower cost technologies as we move into these. And my last point is on what kills babies. So we had clean delivery kits, but in water scarce environments, we have very little in terms of technology to clean hands. So hand sanitizers, which are affordable for people to use in populations where you don't have running waters and you don't have interventions that can clean hands. That's the low-hanging fruit that the industry can provide us and would make a huge amount of difference in the field.
When you come into developing countries to test some of your new products, please set up a framework how these have to be tested. Because these are babies, ethics. I think those frameworks don't exist. Start thinking about it when you move on. Second, when you decide how marketing has to be done, don't forget the maintenance part. An equipment lying out there 40 kilometers away will not function for a small piece, and nobody comes. So the same standard that we apply elsewhere, uptime of 95% should be ensured when such technologies move into our countries.
One is that we generate the evidence for whether these technologies are really working, because it takes a lot, obviously, to get these technologies out, and they need to be appropriate, obviously, for the context. But if they don't work, they either need to be refined or they need to be stopped. And one of the most difficult things is stopping interventions that have been put in place that don't work and suck up resources and actually can cause harm. One of those examples is normal routine episiotomy of women during labor and delivery, which is still being done today and is actually quite harmful. So while we're doing the implementation and scale up, I really want to make a plea that all of you involved in doing that generate the evidence for whether it is working and having the kind of impact that you think. The second thing that hasn't really been discussed here has been whether or not we are putting these into place and making sure that they are socially and culturally, contextually specific and sensitive. I'll give you an example, and it's not to be a downer on ultrasound because I think there is a lot of potential there. But ultrasound is also sometimes used in some countries for gender specificity and exclusion. And that leads to harmful outcome if used inappropriately.